Thanks for joining us here on the Urban Debate. Tonight is a special conversation. We've often raised the issue of mental health. We've often emphasized on the need to make ourselves aware and to be helpful to those around us. Because the last time we had a series of mental health conversations was when we had first gone into a lockdown. We'd done a special series then. The conversation at that point of time was largely revolving around how to deal with the repercussions and the impact you may have on your mind space and your mental health when you're in a state of a lockdown, when you're away from your loved ones, when you're unable to step out for days together, when social interaction is bare minimum, you're not even able to reach out for help. This time, the situation, of course, is completely different. Today, almost everybody that I know, and I'm very, very sure every single one of our viewers, we are spending hours together on the phone, seeking out contacts, trying to help people. In every WhatsApp group that we are present in, there are queries after queries coming in, SOS after SOS, people seeking help for oxygen, seeking help for a hospital bed, an ICU bed, seeking help with a drug, seeking help for plasma donor. Every message is filled with the same anxiety and desperation. And all of us are simply trying to then help, source some available information, source the contact of a supplier, find a hospital that may have a bed. We're spending hours doing this. Many of us have had it more difficult than even this. We have seen our family members go through it. We've seen our family members in serious conditions, even our friends, our colleagues. And then there are many, many more who've had to suffer loss. Loss of a loved one, a family member, a very close friend, a dear colleague who you spent hours together with in your workspace, an old friend, a teacher who left a impactful mark on you in your childhood. So many valuable pieces in our world, in our life. And almost all of us would know of someone we've lost in these trying times. The grief that comes along with that loss, the impact that comes along with the trauma of running around for any kind of medical help, the anxiety that comes along with the fact that what if it is your child tomorrow, your partner tomorrow, your parents tomorrow. These are all real emotions and stressful issues that we are going through. And so it is extremely important for us that as we talk about the physical impact of this pandemic, as we talk about the medical attention that the COVID patients need to rid them of that infection, we also talk about the impact it's having on our mental health. Tonight I want to talk a little bit more about how to deal with the loss of a loved one. How do you come to terms with the fact that you weren't even able to say a proper goodbye? How do you come to terms with the fact if you've been at one of those crematoriums where you spent 12 hours waiting, just waiting? What do you do with all of that pain and trauma? How do you heal? How do we collectively as a nation heal in the coming few months? The damage has been very, very grave. We don't even realize that right now. So let me say a welcome to all the experts who are joining us this evening. Dr. Anita Sukhwani, consultant psychiatrist, the member of COVID help team in Mumbai. Usha Krishnamurthy, a counselor with Apollo Shine. Dr. Saumitra Patare, director for the Center for Mental Health, Law and Policy. Dr. Santosh Chaturvedi, consultant psychiatry and former dean for NIMHANS in Bengaluru, Dr. Saida Rukshada, psychiatrist and psychotherapist, joining us this evening. Dr. Chaturvedi, if I can start off with you. And I want to, like I said, specifically talk about the impact of when you lose somebody and you lose someone to such unprecedented circumstances, when the entire process itself completely leaves you, torn apart. How do you deal with that?
It's a very difficult situation to deal. A loss of anyone in the family or a loved one is a bereavement. And the reaction
We seem to have lost the line with Dr. Chaturvedi. We're going to try and get him back and ask him that question. Let me actually also take it across to Dr. Anita Sukhwani. Dr. Sukhwani, the same question to you. What do we say to people? How do they deal with this right now?
Okay, so this is very live, what you're talking about. We are seeing this daily. Can you hear me? Am I audible? Hello?
Yes, I can. Go ahead, please.
Okay. No, it's a very difficult situation for relatives, what they are going through. In fact, like you said, I'm on helplines, and this morning I've had a call from somebody in Delhi. She's lost her mother in the hospital, and she admitted her against her wishes. She's full of guilt. And then her father is suffering from COVID. She doesn't know how to help him. She's suffering from COVID. The doctor who is helping her is in the hospital. She reached out to me. So there is fear, there's helplessness. She didn't know what to do. And in this situation, all we can do is collaborate with the doctors there. I had to reach out to somebody in Delhi and get her online and help her immediately. So the whole thing is there's a lot of helplessness. What do you do? Where do you go? Who will help me? They don't know. Even the doctors who are treating them are down with COVID. So where does the person go? So it's a very, very tough situation, and the ground reality is very, very sad.
Yes, and how often are you now getting such calls on the helpline number?
Actually, this helpline has been initiated in the last few days, and since it has been initiated, we've been bombarded with calls. Things were better and things have settled, but unfortunately, again, it has blown out of proportions. And the moment these calls have started, we are bombarded. I mean, you can start morning to night. Luckily, this time we have divided our duties, and every person who is on duty has got many calls. And especially the calls are relating to helplessness, hopelessness, fear. They don't know what to do, and they need to understand how to handle themselves in that situation. So we are there to provide hope, to help them in the moment, to reach out to a near and dear one, and provide them with some reality, some hope. And they need to reach out to us to talk to us at how to handle themselves better.
Yeah, and Dr. Saida Rukshad, I wanted to come to you on this as well. There have been so many stories where within a family, there have not just been one but multiple, fatalities and losses to COVID. There was one instance from Pune where a man actually lost his entire family, 4 members, over a period of 15 days. A lot of it was to also do about shortage of medical infrastructure. So, even the days preceding that would have been harrowing, and then the loss. In Jaipur, there was a similar story. In Madhya Pradesh, a lady was so depressed over the loss of her mother that she ended her life after she lost three of her family members, including the mother. It's an extremely dangerous and scary scenario that we are looking at on a larger scale. What can be done? How do we spread the message and make some help available?
Thankfully, we do have a lot of mental health helplines that are already active, that were active last year as well, and they have got reactivated again. They never stopped working, but unfortunately now that the demand for it has risen, there are a lot of healthcare healthcare service providers, mental health providers that are available for consultation. They're available just to talk, just to listen. So we do have help. How do I, as a family member, deal with multiple losses? How do I, as a doctor, deal with multiple losses? How do I, as a neighbor, a friend, or a friend of a friend, deal with multiple losses? At this point, we don't know anybody in our country who hasn't lost someone that they know. So then we realize that, okay, this is something that's going beyond me. But at the same time, I can reach out to anybody that I feel emotionally connected to as well, and they will understand what I'm going through, and they will lend me a shoulder to cry on. Because there are positive cases, we are discouraging, of course, going to meet people, especially when somebody's lost someone, because we are assuming that there are positive cases around that area continuing to be positive. We are going to recommend that call, text, video call, even if you're just calling and crying on with somebody. The collective grief sharing is also a very cathartic moment, and it helps you. Just the other day, we lost a young third-year resident, psychiatry resident, and a colleague of mine called, and we were doing a mutual grief session where I was trying to comfort him and he was also trying to comfort us. So at this point, reach out to whomever you think will listen. This time round, the grief is different because it's not just about losing a loved one, but the process and the way that they've lost is also added to the grief and added to the angst of people, because a lot of times they were running helter-skelter, scared for themselves and for their family members, trying to get some help, and unfortunately they didn't get this on time. And they know that if they would have gotten it, they would have, probably their loved ones would have been saved. So that added extra anger and frustration that is coming with, that's another part of the loss that's complicating the grief process, and it's the bereavement process is going to get a little bit more, we're going to see more, unfortunately, psychiatric disorders, which we're already seeing with people with survivor's guilt. I know my colleagues who are psychiatrists themselves have survivor's guilt and who are whiny why I was positive and I got saved and that person didn't. So even doctors and healthcare workers are getting survivor's guilt as well. So we want to see to it that we try and process our loss as much in a healthier manner as possible. Reach out, call, speak to whoever, whether it's a helpline, whether it's a friend, whether it's a relative, whether it's a neighbor, anybody that you know that you feel comfort with, please speak to them. It doesn't need to make sense. They don't need to be professional, but if you definitely feel that you need to speak to somebody professional, reach out and take help.
Yeah, you raised a couple of interesting points, and I want to follow up on that in just a bit. But Dr. Chaturvedi, if you're back with us, we lost the line with you. We couldn't hear you. The question to you, of course, was that this is an unprecedented kind of a situation where almost everybody that we know has lost someone. How do we heal?
Yeah, so it's like a mass grief, as it happens in various other situations in the past, in the last maybe 15, 20 years, like the tsunami and the earthquakes, where, hundreds and hundreds of people have died and unexpectedly. And, but this time it's even more different and more challenging, because it's going to be a very, very severe grief that people are going to face, because many of them are not able to see the dead body of their loved ones. Many of them are not able to participate in the rituals. See, the rituals in our country, whether, of any religion, they are like cultural defense mechanisms. They help the person cope with the loss. So, which they are not able to do because of the various restrictions, both medical as well as the lockdown related restrictions which have been put. I'm not questioning the restrictions, but the impact that it is going to have. And this is going to be like an anniversary reaction, time after time, year after year. I mean, now I think most of the public and at least the medical professionals are very sure that this pandemic is not going anywhere. We have already seen the second wave. Some places there is a third wave coming, and this is going to be a part and parcel of our life. So anytime such a thing happens, or any other viral infection will happen, it will create a PTSD sort of a thing, a revival of the sad memories of the things that people have gone through. And it's going to be, such complicated grief is going to give rise to a lot of chronic mental health problems in people. It's not only about financial stress or coping with job, but it is about coping with oneself. It is even much more spiritual healing that is required, to understand the meaning of this. Why is it happening? Why is there so much of uncertainty about death? Nobody can predict anything, and that is what is causing a whole lot of problem. So the therapies for these are, something which is not very tested. We are going to use, as mental health professionals, the traditional methods of dealing with grief and bereavement, degriefing the person, providing them help and support. But it is not going to be so simple. Time will tell how we will need to have a different type of approach for such sudden, unexpected deaths, where people are not able to, participate in the funerals or the rituals, and they have to live with this, lifelong and year after year.
Yeah. So very true. And so there is angst about the whole
Yes.
situation and the system. There is trauma of what you've gone through in trying to save your loved one. There is grief about the loss. There isn't proper closure in many of the cases. There isn't a closure at all. There is also anxiety for those who are still with you and what may happen tomorrow. All of this collectively, Dr. Patare, what is it that one watches out for in terms of signs to say, okay, now maybe it is time to get out there and get some help?
Yeah, thanks. I kind of agree with what Professor Chaturvedi said. And I just wanted to highlight that there are about very specific vulnerable groups that we may want to focus our attention on. And let me outline what those vulnerable groups are. One is people who already have a pre-existing mental health problem. And maybe they've lost their only caretaker. People with severe mental illness living with an elderly parent, for example, and they lose that person who's providing them with caregiving support. That is a big issue. That's a particularly vulnerable group. In that group, we've also not done one more thing, which I think is really worrying. From across the world, there is evidence now that, after age, the second commonest risk factor for death with COVID is schizophrenia and severe psychotic illnesses. And most countries are prioritizing people with severe mental illness to receive the vaccine. We've not done that in our country. We've not prioritized them for vaccination. So there are a bunch of people who are completely forgotten by all of us and the system. The second thing that is happening is that many of these people are not even receiving the care and treatment that they should be receiving now because of the COVID-related restrictions, because the health system is overburdened and mental health resources are directed, rediverted towards COVID-related treatments. So that's one vulnerable group we really, really need to be looking out for. The second vulnerable group that we need to be thinking about is people who have recovered from COVID. Again, lots of evidence from across the world that people who have recovered from COVID suffer psychiatric complications in the months and years afterwards. And especially if that is now combined with the loss of another loved one who did not make it, then that's going to be an even more complicating factor. The third vulnerable group, again, which we need to work with, are the healthcare workers. And Rukshida mentioned about psychiatrists and residents, but I think the whole gamut of it, healthcare workers, everybody, are people who are not anticipating this kind of having to deal with death, and especially with the sense of helplessness that has happened because the resources are limited and people have not been able to be saved by them. So that's a third vulnerable group that we need to really be working on. And the fourth group, obviously, is all of us who are equally vulnerable because we've lost somebody near and dear. And in that group, again, there are two particular groups of people I would want to highlight. Young children who have lost parents, in many instances lost both parents and are now orphaned. And that is a group of young kids who are going to require a lot of help with grief and coming to terms with not only with the loss of loss with the COVID, the interruption of education and all of that, but also now with loss of parents and all the material problems that it will bring with it. So that's one particular group. And final group is the ones, the people who are out there. There's a whole bunch of civil society activists who are out there helping people, trying to procure oxygen, beds, and they are going to exhaust themselves and are also going to have a lot of sense of guilt and feeling that they were not able to do things for people or seeing people die in front of them. And that's a group, again, we need to really be focusing on. So, these are some of the people who we need to really prioritize in terms of providing help and support. And each of these groups will need very different kinds of help and support. And what we really need is some kind of, local, regional, state level planning for how each of these groups can be supported in the coming months and years.
Yes. Okay, so let's talk about some of these groups. And actually, I did want to ask about children and teenagers or youngsters who've lost their parents. Any which ways, their entire world has turned upside down in the past 1 year, and now this is just disastrous on so many levels. How do we help them, Usha Krishnamurthy? What can be done to help out these young minds?
Sometimes just talking or about this crisis makes us feel so small and insignificant, because the impact or the effect it's having, as you say on a young child who's lost his parents or one of his parents. So having said that, we have to understand that any kind of pain makes you feel very small and makes you feel like you're very alienated and alone. And whether it is somebody who's very young or somebody who's lost a family member or earning member, I think one of the things that could really help is to be able to take that step back, to be able to kind of we call it distancing, emotional distancing, whether what are the kind of techniques they can use as a community, how we're going to rally around these people who would require that kind of emotional support as well as cognitive support. Sometimes we focus on the emotional support that we give people, not understanding that sometimes it also helps to give them some constructive cognitive support as well. I mean, I remember last year being on the same channel talking about COVID and its impact, and we are back here 1 year later. I'm just wondering if we could, do time travel and say maybe 1 year later, if we are going to be looking back on this as to how, as a community, we really came together. We are seeing enough instances of communities coming together, of groups coming together. There are NGOs coming together. While we are hearing of oxygen shortages, we are hearing of communities coming together and providing oxygen cylinders and spending, day night to get or source things for people. So I'm saying, can we also focus at this time that while we are feeling alienated, and there is also a huge amount of chatter in our heads because we are so exposed to so much information. A lot of the clients who are talking to me are those who are having a lot of anxiety and fear because of the images that they are not able to stop. I mean, or that they are seeing on Instagram or on the news. Or so to understand that what we can do right now is to take care of ourselves, because a lot of the stress is showing up physically, and that is also making us a lot more immune to the virus. So what is it that we can do proactively to take care of our health, whether it is talking to having a support group, whether it is spending time in nature because that is so restorative, whether it is for children especially, they talk about the Batman theory, where they tell children, how they're going to deal with it if they were a superhero, or whether we are, talking like illism, whether we are, talking to ourselves in third person. So to use anything and everything that helps us to kind of ground and to stay grounded, so that we are able to kind of, deal with the chatter on our head, in our heads right now, because right now I think we are just completely overstimulated. I am also understanding that whatever our other panel members have said, that there is so much that we are going to have to be dealing with in the coming time. But proactively, what is it that as individuals we can do to be responsible for our own mental health? So whatever it is that we can do.
May I add something about children here?
Absolutely. Yes, absolutely. Go ahead, please.
So, taking off from where Dr. Krishnamurti said in terms of what can you do, when we're talking about children, last year we didn't see a lot of young people dying, so we didn't have to worry about children who were orphaned, who lost one parent or both their parents, unfortunately. But now this year we are seeing that what we can do as individuals as well is try and give those children some amount of stability that has been yanked away entirely. Maybe the school and their teachers, who they were seeing online, they were used to seeing online, the friends that they were speaking to online from via school, they could kind of help in with grief counseling. They could just stay in touch with them a little bit more, maybe. At this point, I'm not sure, maybe school counselors are not available, but even the teacher that they have and that they have been working with could maybe play an important role. And the rest of the family members, like I said, if we could continue to provide that kind of stability that is not there, will help them process however they can process, because we know of very young children who've lost their parents who don't even understand what death is yet. So yes, we all have to come together and do whatever we can, but schools can play a very important role in children's lives.
Okay, yeah, actually, I was going to ask you about this as well. I wanted your thoughts. So, thank you for sharing those. The other aspect, usually what happens is that when there is a big loss, a big personal loss, and you lose somebody extremely close to you, a lot of people just, close up. They just shut down. They don't want to share about it. They don't want to talk about it. And Dr. Santosh Chaturvedi, what is it that people can do to then reach out? Because normal attempts may not work. But while you while you would give them their time to grieve, to mourn, to find closure, at what point does a third person decide that, okay, now maybe I need to do something else to reach out and help them?
Yeah, so mourning is another very important factor which helps people deal with grief. And mourning is a social phenomenon. Now, with social distancing, mourning is become even more difficult and challenging. So people don't know how to mourn. So it has to be a lot of it has to be online, or one to one on phone or WhatsApp, and having groups which are also virtual groups. But I would like to point out one more thing in connection with the discussion which has been going on, is that grief, as Dr. Pathare had said, causes a lot of psychological problems, but also biological problems. It actually reduces the immunity of the person. And sadly, that makes the person more vulnerable to a subsequent infection. So we have the mental reactions, the psychological reactions have in turn effect on the physical status of the body, and the physical status has again on the psychological. It's a vicious circle. It needs to be stopped. So what we have to do in such situations, how they can reach out is, I read that a lot of helplines are there, but then people are also complaining. I think they are so much bombarded. There is not enough enough times that they are able to get support. Now, in these helplines, it is not only about information. Each session of a grief is going to take from anywhere between 30 to 60 minutes. And to have that type of time for this large number of people, it's going to be very, very difficult. We have to think of new ways of providing grief support. And in all this, one of the other grief we have not talked about is anticipatory grief. We are all going through anticipatory grief. In my family, everyone had symptoms. Some of them turned out to be positive, and whether you are a mental health professional or not, you start getting thoughts about anticipatory grief. That is this the end? Is this going to happen? And dealing with that is another big challenge. So we also talk about, for example, we're talking about children. Now, luckily till now, the morbidity and mortality in children has not been much. But it also raises an issue. It is not only about their losing parents. Tomorrow, especially the teenagers, when they lose a peer group, when they lose a friend, and when they come to know, even if it's online classes, they come to know someone is no longer there, it is going to be a very, very big trauma. It's like for you guys, everybody takes media persons as a punching bag. But I read about one of the journalists from a news channel, a TV anchor, lost his life. So you remember him, and anytime any other anchor will go, would think about that. So these things are gradually going to become something like what I mentioned a bit earlier, like a PTSD sort of a thing. You will get strange images, strange recollections, and thoughts about what happened, why it happened, why me. And it's not why me now, why us, why our country, why is this happening in such a thing. So why is a very, very difficult question to answer. And that's why I said a lot of it is probably one has to look at the spiritual dimension to understand. I cannot explain it on any other way, and one has to think of that. So spiritual support, group support in such large losses. Group support is something which is going to be important, like it happened in tsunami, like it happens in the floods, or we had in different parts of the country. So group support is probably the best, because they are the people who understand each other's trauma. It's like ghayal ki gat ghayal jane. So as professionals, we will tell from a background of books that we have read, or experiences that we have had, but they have been of single deaths. They have not been of mass deaths. It's we were not there, but something which happened like during the Holocaust, or during the Hitler's time, when thousands of people were killed. So we don't have much experience on this, and we are using common sense. Our intention is good, but I think over time, next many years, people would develop good modules of therapy, individual and group, and family
Okay.
therapies, which would be able to help them cope them in the long run. Thank you.
Yes, I think, and for all of this to begin with, there
Can
has to
I?
be a larger, wider acknowledgement that what we are going through is unprecedented. It is going to have a significant impact on how we feel and how we handle it and process it. There is so much of anxiety and trauma and grief all around us. Even if you feel that you haven't had a personal loss, you're actually surrounded by it, and it is bound to impact you as you live and continue to be in these groups. So I think the first thing that all of us have to do is understand it, and then accordingly figure out how to handle it or deal with it. I have a viewer on the phone line, Mr. Krishnamurthy. He's calling us from Visakhapatnam. Good evening, Mr. Krishnamurthy. What would you like to ask or just share?
Doctors on the panel, I would like to express, see, in the first wave of the COVID, we were not even scared much. See, because there was a lockdown, there was a systems were going in, we were not scared earlier in the first wave. In this wave, everybody is scared. And moreover, see, whenever we switch on the TV, we get something very, very ugly, very, very unfortunate news. See, father loses a son, son loses a father. And we see there are so many COVID violations are going on in this wave. And people, my daughter is away from me in Delhi. She was locked up there, and her husband is somewhere, and her son was somewhere. And how to deal with this grief we are facing with how to boost our morale strength, and how to we have to control, because whether it is a government, central government, or a state government, or as you said, a group, or how can we overcome this shares.
Okay, you have asked a very important question, Mr. Krishnamurthy. Many people have the same, thought in their head, and how do we deal with it? Let me take it to the experts. Dr. Rukshada, would you like to take this up? How does anybody deal with that fear of what might happen to us tomorrow?
So I think there were parts of questions there. So one part of it was also that there are a lot of violations. I think the one golden word right now is accountability. We all need to be accountable for our own actions, and of course, the government and the administrations, they are accountable for their actions as well. So I need to be sure that I'm not contributing to the spread of the virus by taking the safety measures. And if I see somebody else, I should call them out. And even if I'm, that wear your mask properly, because again, because some of us who have been vaccinated, there's a sense of complacency that, okay, I'm not going to either spread it or I'm not going to get it. And that leads to that accountability and that internal insight into what can I do as an individual. Because when there's so much of anxiety around, we always advise people to focus on what you can do instead of what you can't do, what's not in your control. So when you're trying to do that productive work and take that productive step, there's a sense of, I wouldn't say accomplishment, but then, like I said, a sense of lessening of the anxiety. And as far as, when we reach out and instead of only hoping for the negative, if you also hope for the positive, and when you're making a call, instead of only asking, is everybody okay, after having asked that question, share something pleasant or share something that is good that is happening today with you, or ask them about it. So that helps kind of reminds us that there's a balance, that yes, there's a lot of unfortunate things that are happening around us, but there is also life is going on, and there are everyday small little comforts that we may have, that we've had a favorite meal, or we've seen something on a streaming channel, or we've had a good day today. So that kind of talking about on mundane things, about everyday life, that may also help quite a lot to all of us. Collectively as well. And it's not just about being positive in terms of everything is okay, but being positive in the way that, yes, we are trying to do, we're taking one step at a time and things are going to better. So when we use reality-based positive self-affirmations, I think that is more therapeutic and that's more productive and helpful to me personally, individually, and to everybody else around me as well. So maybe simple, small little things like that and small changes in attitude like that. And if you do it collectively, it's going to have a better impact.
Can I chip in here?
Thank you so much for that. I have another viewer on the phone line. Okay, yes, go ahead, please.
Tanvi, sorry, I'd like to
Dr. Anita, you wanted to add something? Go ahead.
Yes, yeah. I wanted to add something was that everybody in this situation is feeling a lot of guilt for what they couldn't do for their ones, and a lot of anxiety for the future and feeling helpless. What I want to offer here today is that every caller that calls me, we have to give them hope. Take each day as it comes. Find comfort every day. Live one day at a time and find happiness in small achievements that you see in your child or anybody around you. And you have to learn to bring yourself to the present. We all live in the past and we worry about the future. All we have to remind ourselves, be mindful and be aware of our thoughts and bring ourselves to the present. As difficult as it may sound, but it is a small step towards how we can build up our hope towards the future. That's all I'd like to add.
Okay, thank you so much for that, and I hope that helps Mr. Krishnamurthy, who had called us. If I may just go on to another caller, and then maybe you can also come in. He's been waiting for a while, and I don't want him to wait any longer. Apurva Parekh is on the phone line from Mumbai. Hi, Apurva. Do you want to share something or ask a question?
Yeah, I want to share. Since last March, because of this home isolation and lockdown, I am at home. That is affecting my finances a lot. I mean, I am living on my PPF and the other income. I do not know when it will end. Another thing I wanted to ask you, I feel so sad in Bombay. We don't have beds. All the hospitals have boards. No beds, no vaccine, no ventilators and all. God's temples are closed. All the religious institutions are closed. I know when will this end. I feel so sad, locked up, cooped up in my room and seeing all this misery. And I want to add, Supreme Court has today asked 10 questions to the government to answer. And I really want to know from your psychiatrist how we can combat this depression. We have never in my 62 years of my life faced such a situation. It is Operation Loot. Everybody's looting.
I understand. I thank you for sharing. Yes. Yes. Thank you for calling us, Dr. Parekh. And I just want to say that you're not alone. There will be people who are there to hear you and to help you and to share with you. And I'm very glad that you at least called us and shared with us. Let me just take it over to our experts. Dr. Chaturvedi, a 62-year-old Mr. Parekh, who's calling us from Mumbai. Anything that you can say to him?
No, well, I fully understand, and I also agree what you have said. He is not alone. A lot of people are going through the same thing, but that doesn't make it easier for him. But this is going to be there. It's people are going to have financial difficulties, difficulties of being locked up in the place. No support from anyone, especially elderly. If they are alone, it's even more difficult. So these are very difficult times. And I think one of the panelists had told earlier, it is a good message. We need to take one day at a time and see how things go. Another thing is that with these lockdowns and restrictions, there is, last year also I was in a lot of these programs, and one of the message I would give is that the social media is the new social support. So connect with people through WhatsApp or phone or Facebook or anything that you can do. Be in touch with people. You cannot touch people physically. That is what people are missing. You can't hug people. You can't shake hands with people. But you can still see them. You can still talk to them. You can share with them. Try to help them. Listen to them. Listen to each other. So this is going to be there, and there will be lots of ups and downs. We have no idea and how it is going to progress. There is no end in sight. There is another thing which the previous gentleman had asked. One of the message was when he said, people are having fear and all. And this is the message which I had given last year was, "Jo dar gaya, wo bach gaya." Fear is therapeutic here. Having little amount of fear makes people more cautious. It is the bravado of the Kumbh, bravado of the election rallies, and now we are seeing the impact of that. People thought that there was no need of fear. Everything has gone away. Had they had fear, people would have been more cautious. The fear is for the caution. It is a good fear. Unless you have that optimal level of fear, it is going to spread like wildfire, like it is doing now, and there will be no end to it. So help each other, look after oneself, look after each other, try to do something good as possible. Use religious, spiritual, whatever methods help you to help each other, because it's going to be very, very challenging times.
Can I just add something here?
You know what Mr. Parekh was saying? Yes, please, absolutely. Go ahead.
Yeah, I think Mr. Parekh's question highlights the real problem that we have at the moment, which is with all of the commendable effort that is being done by mental health professionals, volunteers, helplines, the fact remains that we will never have adequate number of professionals to be able to address everybody's problems at the moment. And so what we really need to look at is more innovative ways of trying to be able to reach to people like Mr. Parekh with the support. And very often that support can just mean a quick phone call, 10 minutes. We need to really look at peer counseling. We need to do large training of lay health workers who can do that level of counseling. Many of these people, like Mr. Parekh, is a good example of that. Don't necessarily need a psychiatrist or a highly trained psychologist. What they need is somebody who's available to talk, somebody to have a conversation with. And that kind of training, and there are many such programs that do run in the country. What we need is a slightly more public health approach to this whole thing, which is, having an estimate of what we need and who we need, and actually putting in place training programs to prepare people quickly. I mean, during tsunami, Professor Chaturvedi knows that very well, or after the earthquakes that we had in Bhuj and Latur, a lot of people locally were trained to do peer counseling. And that is the best and accessible help that you can have when you have such widespread need. You're not going to have enough number of professionals to meet that need. And so someone like Mr. Parekh, that's what I would want to be seeing. Like every society in our urban areas, for example, could easily have one or two volunteers who are trained in very basic counseling skills. It doesn't take very long to train that. You could do that in 4 days, 5 days, give them adequate training so that they're able to then support people. But I think we need to be looking at how we can scale up all of the support. Just trying to rely on professionals to do it is not going to meet that. That's what Mr. Parekh needs, and that's what places like Mumbai, I would hope that the Mumbai Municipal Corporation will actually take this up as a priority, or the Maharashtra government will take it up as a priority, because places like Mumbai and Pune are going to have a huge need for this.
Yeah, and I think, together the authorities may need to start thinking about this and may need to start planning this. Dr. Saida, if I can come back to a point that you had earlier made and maybe explore that as an option as well. You said, group conversations, or to be able to share your thoughts and anxieties with somebody perhaps could be a helpful method. Now, for those who have been locked up for a year and live alone, could this be an option virtually, if it were to explore and see if it helps?
We know that it has helped, right? We have, even from the past, even before COVID period, we knew that people who are socially isolated, whether they are living by themselves or they're in nursing homes, when they are in their peer group and they're just discussing, talking, even if it's taking an online group yoga class, online group thinking class, these things have definitely made an impact on their mental health in a positive manner and socially improve their functioning as well. So when we're talking about groups in terms of just coming together, the shared experiences, that will definitely make them feel that even if we are in different boats, it is the same storm. And by helping each other out, we are going to be able to help ourselves as well. When we're talking about peer support groups, and the peers can be of any selected group, isn't it? Whether it's of a age, whether it's of a gender, whether it's of a community, whether it's of a neighborhood. So these are your peers, and your shared experiences are definitely going to help you and help others as well. So just yesterday, a 14-year-old messaged me that, her father gave her a self-help book, but she's not being able to read it, and she's feeling helpless. So I told her, okay, why don't you think about it, that you might not be able to take that help for yourself, but if you have this information, and tomorrow if a friend needs it, you might have that information to pass on, even if you don't understand what you're reading. And that really helps her as well. So, sometimes inadvertently we might be helpful to other people. All we have to do is definitely try. And even if you are using your common sense but what more than common sense, what really reaches out to people is the empathy, is the willingness to listen to each other and the willingness to, at least smile and, screenshots are the new photographs. I think those are again one way of kind of reminding ourselves we were here, we did this. So there are different ways of making new memories that we have to relearn and learn again. And so incidentally, every second week of every second Sunday of every month, we have a support group for young adults. And this second Sunday of May, our topic is grief. How to deal with grief, how to express grief, even a simple thing, if you're calling up a friend who's lost someone, how to talk to them. Because, a lot of people don't know what to say. And I saw a movie recently that the youngsters are sitting and laughing that everybody's coming and asking Dadi the same question, kya hua, and Dadi's repeating all over again what happened and how he passed away. even simple things like, and unfortunately on this day and age, talking to somebody who's lost someone has become a life skill that all of us need to aspire, whether we're professionals or not professionals. So simple things like that is very easy for us to find that camaraderie and get that support, emotional as well as social, which will definitely help our functioning and overall quality of life.
Thank you so much for that. I wanted to go back to Dr. Yes, go ahead, please.
Yeah, Tanvi, just to add that we, through this crisis in the past, last year also and this year also, we have to help people get their resilience back, to find their inner strength to be able to help themselves. Like all the doctors have been discussing, we have to teach them to go back to discover their strengths, go back to their hobbies, go back to their music, reading, and try and live in this lockdown more positively. And that will help everybody. That's what I would say.
Okay. Dr. Patare, I wanted to ask you, you spoke about specific groups who obviously need to be prioritized and would need a lot more attention and help. One of the groups also has to be the medical fraternity itself, the doctors, the nurses, the support staff that for the past 14 months now have been doing this day in, day out. And even if we keep the last 8-10 months aside, just the last 2 months, the gravity of the situation, the running around, the wondering that whether you'll be able to provide the next lot of oxygen to 100 patients who are in your ward right now, the obviously high number of deaths that they're looking at is bound to have an impact on them as well. Is there a dire need for maybe, for us to centrally look at a policy to ensure that them and their mental health is also addressed, not later, but now, right away?
Absolutely. I mean, look, you mentioned mental health, but I would also like to highlight that many of them are physically exhausted. They are at the end of their tether physically. You don't have any energy left to now continue because you've been at it all the time without a break for the last 14 months or so. So one of the appeals that I would really make to people is help the healthcare professionals to help you. Don't fall ill. Take precautions, take your vaccine, mask up, avoid crowds. Anything that we can do to prevent falling ill will help the healthcare professionals because it means it reduces the burden on the healthcare system. Having said that, I think the need for healthcare professionals requiring mental health support is obvious. And it's not just, you mentioned doctors and nurses. Don't forget that there's a whole bunch of community health workers who are also involved in COVID-related tasks. The ASHA workers, the Anganwadi workers, the community health workers. There are people at various levels in the health system, all of whom have been working tirelessly. And so providing them with that kind of support is extremely important. We just remember and think about the doctors and the nurses in the ICUs. Obviously, they need to be thought of, but that's not the only group. So prioritizing them is absolutely necessary because if you don't prioritize support for them at the moment, you're going to see a lot more of the healthcare professionals starting to fall ill, both physically and mentally. And that's not going to help any one of us. So, in a sense, we have to look after the people who look after us. And if we don't do that properly, then that's going to be a real problem. And I think that's where a lot of, that's the one place where medical associations and healthcare associations can really chip in very usefully. Because I know that, for example, if a government body set up a health system for a health support line for doctors, then most of them probably wouldn't call up that line. But if you had a professional group set up a helpline like that, they'll more likely talk to their peers. So, this is really one area where civil society and professional groups can make a huge difference.
Tanvi, there is
just to highlight that,
and I think it's the need of the hour, especially for the medical fraternity. It's the need of the hour. My apologies, I'm completely out of time. But what I can say is that, I hope this is helpful for our viewers. It was definitely insightful for me as well, and I think all of us are literally in the same boat. Some obviously are going through tougher times. And I promise this, that we're going to bring many more of these conversations. We're going to pick up issues related to mental health that is seriously impacting our lives right now in these pandemic times. We're going to keep it specific to the pandemic and its impact on our mental health. A big thank you to all of the panelists who joined us, and thank you to the viewers who called and shared, and we hope this conversation was helpful to you as well. Thank you.